Good afternoon and welcome to this webinar hosted by the Independent Scientific Advocacy Group on COVID-19, how to keep it down. I want to thank ISAG for inviting me to chair today's webinar. I'm delighted to be asked, and I really want to commend the scientific community in Ireland for all of the work that you're doing, coming together like this to share your expertise and for the work you're all doing in keeping us informed. And we all have the same goal, to reduce COVID-19. Today is a very serious day in Ireland, the highest daily death toll yesterday, with 101 people dying. You can only imagine the impact on all of their families. This lunchtime, we're joined by a panel of experts to discuss and debate COVID-19 and to explore the different pathways available to us as a country. I think that's the key point, to get the best thinking on this, so that everybody can share it and act on it, so that we deal with this pandemic as well as we possibly can as a country. So we're joined by 4 eminent speakers today, and I'll introduce them separately when they're due to speak. We're going to have an update from ISAG as well, after Kevin has spoken, who is our first speaker. First speaker is Dr. Kevin Cunningham, a lecturer in politics, Technological University Dublin, and Managing Director of Ireland Thinks. Kevin will be leaving us after he speaks, but the other speakers, one who's joining us from Germany later on at 12:30, will be here for a Q&A. So we'll have about half an hour of a Q&A after the speakers have presented. And we'll stick to an hour. We have a little bit of leeway, but it's more or less 1 hour seminar to get the very best from this session. And we'll ask Kevin to present first. Kevin.
Thanks, Francis. Just do the old share screen thing. Sorry.
You okay, Kevin?
Yeah, I think that kind of works. I'm just gonna.
Okay, screen. Your slide is up there now.
That's great. And can you see it's full screen now? Is it? Or?
Yes, it is.
Okay,
yeah.
great. Thanks a million. So I'm just going to present. Just as asked to present on the figures in Northern Ireland, because obviously Northern Ireland is a major consideration in all COVID-0 and the strategy in relation to dealing with the pandemic. So there were 2 questions conducted recently which are relevant. Obviously only a subset of this is the hotel quarantine issue, but similar to a poll that was conducted in the South in the Republic, where 90% were in favour of mandatory hotel quarantine, which was followed up by 2 polls from O'Morrock and Red Sea, which had 91 and 86% there relatively recently. Very similarly, in Northern Ireland, 90% are in favour of this measure. We asked 2 questions. The first question was about introducing mandatory quarantine, including not just Ireland, but also including Britain, in consideration of the sensitivities in Northern Ireland. But you can see very clearly across all demographics, very similar to all the polls we've seen so far, there is very strong support for a measure like this. And in fact, within Great Britain itself, YouGov had conducted an opinion poll, which showed 87% were in favour. So it's the kind of issue that has very, very broad support among the public. A second question to mandatory quarantine that would ensure that travellers from Great Britain would also quarantine. Now, obviously, this had much lower support among the population of 65% to 30%. It's interesting just to understand the political dynamics within Northern Ireland, and that you have a nationalist vote, obviously, and then the unionist support for the issue is obviously much lower. It's worth considering and acknowledging that there is a minority within the unionist community that is in favour of measures to deal with the pandemic. You can see the overwhelming support among those from the Alliance Party, but then also even among the DUP and UUP, there is a minority of interest there in relation to introducing quarantine from Britain. It's arguably going to be very difficult, or if not impossible, to try to introduce something like this within Northern Ireland for a couple of different reasons. I'll just talk briefly about the political context. I think to some extent the ban on travel from Britain within Northern Ireland is probably out, not just because the potential for petitions of concern from the DUP to prevent something like that, but also, as we've seen quite recently, with an opinion poll conducted the weekend, in fact, in the Belfast Telegraph, showed that the DUP has lost quite a lot of support to the traditional unionist voice. This may sound like a sideshow sort of issue, but it certainly hardened the DUP's stance on quite a range of issues. And we saw even yesterday their strong moves against the Northern Ireland Protocol, because of fears of kind of basically hardline unionists kind of eating their lunch at the minute. So I'd find it hard to see how the DUP would move in the direction of the moderates at this point in time, given the rise of the TUV. Another question is, though, whether there is any scope for any independent decision making in Northern Ireland, independent of what happens in London. And one consideration is the fact that, again, it was just yesterday that Nicola Sturgeon obviously announced a deviation from UK policy with the demand to introduce managed quarantine. I'm not exactly sure what she meant by managed quarantine, but to do that for all travellers to Scotland, regardless of what country they came from. It's also worth noting that Robin Swan, who is very, very popular, is the obviously health minister in Northern Ireland, but within that poll recently conducted, Robin Swan is enormously popular. His approval rating is something like plus 63%, which is unbelievable for any politician in Northern Ireland, not least politicians of Northern Ireland. So he is extraordinarily popular, and with that popularity, he has some political clout to actually drive things a little bit. And his recent note suggested a cross-departmental group, the establishment of one, to consider enhanced quarantine. So even, and his statements in that group reflected very similarly what Nicola Sturgeon was saying around the idea that the existing measures of reactive measures to where the red list countries, as it were, would be in the UK, would be too reactive due to the lag. And so he seems to be very much on board with it. He obviously has a lot of popularity, but whether he alone can actually do this is up for is undetermined at this point. And then finally, just in relation to there is broadly support for decisions to be made within Northern Ireland. So when you ask people within the North where they want the decisions about COVID to be taken, there is to some extent an idea of shared decision making between Northern Ireland and the Republic and the UK, but there's very little support for those decisions to be made outside of Northern Ireland entirely. So, the idea of the decisions being made mostly by down here or mostly by the UK, there doesn't seem to be much support for that. And so really it being led by the North is quite an important consideration. And the final slide I'm just going to present is other additional polling information that might be relevant. The support, this is an Amoric poll, support for the border in Northern Ireland being closed had very high support for that of 71% here. And that reflects similar figures we've seen throughout around support for really controlling travel between Northern Ireland and the South in particular. That's been quite consistent. There's been a lot of changes in public opinion as the cases go up. People start to want more restrictions as the cases go down. People start to want less restrictions. And pubs and restaurants actually follow some of that. So at the minute, there's a lot of opposition to the opening of pubs and restaurants. But undoubtedly, that may change as the cases come down. People feel it's safe. However, there is support for this last lockdown as per the Amoric figures. And then another consideration within this is another thing that's quite consistent is the support for keeping schools open does seem to be quite consistent as well. So that's just one of the kind of different challenges in relation to introducing greater restrictions, in that things do change, although I think the general public do appear to have acknowledged what's happened at Christmas time, and so the idea that pubs and restaurants should continue to stay closed, it does seem to be strong support. But one particular challenge is, as I said, attitudes towards schools and whether that's a feature in and of itself. I guess I'll leave the kind of experts to discuss more greatly. And so that's it from me.
Thanks, Kevin. Look, I guess I know you have to leave immediately, but bottom line from your surveys that you put together, there seems to be strong public support for pandemic measures at the moment, of a variety of measures, really.
Yeah, absolutely. Yeah, I mean, particularly into the country and around the borders, there's quite a lot of support for that. I mean, quite overwhelming support for the border, tightening the borders and sealing it off, I guess, as much as is possible.
Okay.
The other measures, obviously, there's a little bit more differences, and schools is more highly prioritized, but pubs and restaurants, it's interesting to see this development in relation to pubs and restaurants, because that's very different to what it was in November. Whether they'll change again as cases go down, I'm not sure. But
I guess people are very scared at the moment and really seeing the numbers and the deaths, and therefore very much behind public health. So it's a question of how you implement that, which I'm sure we'll go on to discuss. What does that look like? What would those measures look like? Which I guess is where the main debate is. Thanks very much, Kevin. I know that you have to leave. At this point, Paul Dempsey is going to give an update on the work of ISAG. Paul, I think you're joining us there. I think you're on mute there, Paul.
Yeah, sorry, I'm just going to get the presentation up now.
There you are.
Okay, so this is the situation update from today. Looking just first at Northern Ireland and the age profile and how things are moving along. Again, as in previous weeks, I tend to use this logarithmic scale because it's easier to identify patterns. The reason for that in infectious diseases is instead of it just being 1 to 1 to 1 to 1, it tends to go from 1 to 2 to 4 to 8. So it's like we multiply up instead of just adding. What we can see here in Northern Ireland, if we look at the purple line, is that the over 80s continue over the last couple of weeks to follow the rest of the population, which is a big deviation than previous occurrences, where they stay steady, where the care homes have a different reaction, different dynamics to the situation. So this suggests that the vaccine is starting to have some impact in Northern Ireland, and their targeting of the care homes as well in particular. If we compare that to the Republic, we can see here the same kind of reaction with the 85 pluses before, but also still now we see that the 85 pluses aren't dropping as in the same way as the rest of the population. So that just means for now, vaccines won't kick in soon enough. What we really need to do is try and get the cases down, because the only way to get this down is by bringing down the rates in the community as quickly as we possibly can. It may have looked like we were doing that earlier in this year, but one of the main factors has been this introduction of B117, and the latest data that was released from NEFIT last week kind of gave us some better abilities to figure out how much of an advantage it has over the previous strains. And we've seen this real drop down in cases that we've all kind of celebrated to a degree in the media. But if we look at the percentages of what B117 is taking of that, we can see that the blue bars here really aren't decreasing an awful lot. We're not, basically, in many ways, it looks like we've just kind of wasted the last month trying to deal with something we've been able to deal with in the past and not taking up the new challenge that B117 gives us. We do have a lot of room. For most of us, we're in a lockdown, but there's quite a lot of us who are still, there's twice basically what was it in April, still out and about working and doing more activities. While B117 is more transmittable than the previous versions, if we take the right procedures where as many people as possible can stay at home and we look exactly what's essential, it doesn't really matter how transmissible it is, because public health people know how to control that, and the kind of the mathematics behind how spread works breaks down if enough people are staying at home. Okay, that's me for now, Francis. Thank you.
Thanks, Paul. Quick question, Paul. You used a phrase there, I think, that'll disturb people. Wasted the last month. What exactly do you mean by that in terms of, is it the public health messaging about, because it's this B117, that we just need to be even stricter than we have been, or that people need to adhere more towards 100%? Just give me a quick response on that.
I don't think there's any adherence, obvious adherence issues, other than from that we see the activity on the road. I have a data from previous week as well. There's just more activity than we had in April by about double, which is just too much, and it doesn't need any of that kind of air. It's well able to eat that up itself. It's just too, there was warnings back at the beginning of January that more needs to be done. Basically we needed to do April again, and we haven't. We've left too many things open compared to now. So while the vast majority of us are in effective lockdown, there's still enough circulating around that's dragging it out for the rest. Okay,
and the over 85s here, you said really it's about getting the community transmission down.
As quickly, the quicker it goes down, the quicker they will eventually come down. It's all the same with on the way up. They'll go up when the cases go back up. So the way we are right now, any reopening or any attempt to reopen would drive back up community, and then about 3 weeks, 2 to 3 weeks later, if the care homes aren't fully vaccinated, then they'll go back up in them again as well.
And the vaccination, of course, will be a protection.
Yeah, well, it does appear to be in Northern Ireland in that case, and similar something in the UK as well.
Thanks very much, Paul, for that update. We'll go on now to our second speaker, and that's Andrew. Andrew is joining us here. Yes, there you are, Andrew. Andrew is the Patrick J. Johnston Fellow in Cancer Epidemiology in Queen's University, Belfast. You're very welcome, Andrew, and you're going to speak to the topic of supporting isolation, a pathway to zero.
Thank you very much. I'm just trying to find my slides. They've disappeared from my share screen option. There we go. Can everyone see that okay?
Yes.
Right. Well, thanks for the introduction. I'm Andrew Kunzman from the Centre for Public Health, and I'd like to talk about supported isolation and the neglected areas of how we can get cases down and keep them down. So I saw this quote recently from Dr. Michelle Kelly-Irving, and I thought it really hit the nail on the head. We do not face the virus, nor the measures used to stop it equally. And I've got some pictures there to kind of show the discrepancy between the people who are still working in essential jobs and still facing unique hardships in terms of household transmission on public transport, and transmission in their workplace, and contrasting that with a picture similar to my experience of being able to work from home. Now, that's not always easy, and I know women in particular have borne the brunt of childcare responsibilities, and it's not always easy. So it's not to say that this is unfair and that only people that work from home have it easy, but it is to show that some people are still at risk. And I think that's one of the neglected areas that we need to focus on. So how are we trying to stop spread? We have restrictions in place which offer a blunt but effective tool for reducing contacts in the general population. But as I said, essential and key workers remain at risk. And to combat that, we try to use testing and contact tracing, which are targeted measures aimed at isolating the people that most need to isolate, those that are infected or potentially infectious if they've been in a close contact. But if people with symptoms don't engage with testing, then spread happens. And often the people we most need to isolate often can't or can't afford to. And I think that's one of the issues missed with the stay-at-home message. some people can't stay at home, unfortunately. So the Irish Times today had a piece about, is COVID-19 plateauing and have our sacrifices been in vain? And there's a discussion of what might be causing that. And I think the reason that is that the occupational transmission always comes down a bit slower. There's also concerns about the new variant, which will make it even more difficult. But there's a nice figure from Toronto that I was unable to find figures elsewhere, but I have seen from my hometown in Leicester that I've not been able to visit in over a year, that this followed a similar pattern. So communities with the highest proportion of essential workers continue to have the highest case numbers. And you can see that in the blue line that the figures came down fairly quickly or didn't even go up too much in the more affluent communities with less essential workers, whereas they rose higher and stayed higher for longer in the communities with more essential workers. And I think that pattern's going to repeat itself by the looks of it in Toronto. And I think we'd see a very similar pattern here. So one of the reasons for that is the number of people who actually isolate is actually a lot less than we would assume. So there's a brilliant study called the Corsair study in the UK. And now this context might be slightly different in Ireland, but I imagine it would be fairly similar. And it almost certainly is in Northern Ireland, and we're going to be studying that soon. So over 70% of people intended to comply with test, trace, isolate rules, but in the end, only 20% actually did. So that's only 1 in 5 people who need to isolate are fully isolating for that whole period. So that leaves a lot of scope for improvement and means that there's a lot of waste in the test, trace, isolate system. And the non-adherence was associated with being male, younger age, having dependent children in the house, which does bring up difficulties in how people are going to isolate fully if they've got children. Lower socioeconomic grade, greater hardship during the pandemic. So people without savings may be completely unable to isolate. They can't take time off work. They can't afford to do that. And that they may not have as much food in the cupboards to be able to last 2 weeks or however long their isolation period is. And key workers, and that's the bit that scares me. If key workers are unable to isolate, then they're likely to be in contact with a lot more people than me or you. So occupational transmission is the area of interest, and I'd like to highlight an area where NPHET and ISAG completely agree on, and this was a quote from Ronan Glynn recently. People are acquiring this in their workplaces. Now is not the time to be going into your workplace unless you really have to. Now, unfortunately, some people really do have to. They're essential workers, and this is a picture of a meat factory, and you'll see that the protections for those workers in this example, and this may have changed since, aren't as strong as you need, and they have to work in quite close contact and in shared air spaces. So this is a considerable area of risk, and meat factories have very much been the front line of the pandemic. Many of you will remember the Kildare outbreak in summer, and that was the point when I went, we've lost control of this. We've gone from maybe we can redeem this to actually we've got it, because once it hits a busy workplace, it's going to spread very fast. The other area that I think is neglected is some people don't have to be in work, but employees don't decide. So saying work from home if you can, it's not their decision to work from home for many people. I was fortunate in early March when I was reading papers saying this is going to be bad. I told my boss, I'm going to work from home for a bit. And she said, actually, yes, I'm going to do the same. But some people don't have the opportunities that I was granted. so are still in the workplace. And the data from England shows that offices are actually one of the major sources of spread at the minute. And they're the areas where we can really make a difference to bringing cases down quicker. The other issue is that work and households are kind of multipliers of risk. The people that are most at risk in the workplace are often most at risk in the household as well. So I've got a hypothetical example that I'm sure will have been seen many times. A worker develops a cough. They either can't afford to isolate, so don't reveal their symptoms and maybe downplay it, or they tell their boss and the boss says, no, come in, we need you. They then go into work, an outbreak can happen or spread can happen. Then the workmates live in a cramped room, and this is a picture of one such example. Their housemates work elsewhere and then bring it to another workplace, and then it spreads within that. So when Mike Ryan talks about breaking chains, these are the chains that really need to be broken, especially during lockdowns when the vast majority of people are doing their best to not be in a chain in the first place. So one of the things is some people are saying, well, that doesn't affect me. Why do I need to care about this? And I mean, that's not a view I share at all. But would you want the person at the checkout at Tesco or wherever you do your shopping to be able to self-isolate when sick? I certainly would, because I think the rules in place and the protections in place may offer some protection from somebody that's asymptomatic, but somebody that's got a cough that may only be a few coughs every so often, the protections won't be enough for that. And there's some brilliant work from the SAGE group and others saying that ultimately people need to be able to isolate without fear of substantial damage to their work, income, family, or caring responsibilities. And I think that's where we can make a difference to what we're doing at the minute. So this is the difference between, we often hear testing and contact tracing, but the other elements are sadly neglected. There's the find, test, trace, isolate, support that independent SAGE have often been advocating for, and we've been advocating for. And this involves better funding for public health consultants. They know exactly what to do on the ground to break these chains and to investigate these. I'm not a public health expert on the actual on the ground work, but they really are. And Ireland has some fantastic people who are going to be able to do that, but they need the resources to be able to do that. Make it easier for workers to get tested. Not all workers in factory settings or other settings can drive or have access to a car. So we need to make walk-up testing available in the areas where they're most needed. And fever clinics are an example of that. There's also options for rapid asymptomatic testing in high-risk workplaces, and I've seen Moy Park, at least in the north, have recently introduced this. And I think that's where the rapid testing will really have an impact. But if we do make people isolate, then we have to make it easier and more affordable for workers to self-isolate. I'm aware that there's a €350 pandemic payment in the south, whereas in the north, it's only £95 a week. And that's far below minimum wage. So we've been consulting with political parties, and we're about to release a letter to the media about how we can improve this. And I think that's the neglected area of focus. But one of the key points is that it's not just about the amount of funding available, it's about making people aware that it's available. Some people, English isn't their first language, so may need to be made aware that these supports will be available, and they need to have it almost guaranteed that if they ask for this money, they will receive it. The other issue is stigma. Some people won't get tested because they feel ashamed that they've got it, and the narrative that stay home, it's all about house parties, isn't really the case for people in key work. They're more likely to have been infected at their workplace. And getting employer buy-in. Each outbreak at a workplace that's deemed essential delays the reopening of the other sectors. We want to see kind of a coming together of employers to say, okay, if you do better at yours, then we can open sooner. And I think that narrative of working together to really drive down cases could be very useful. So all in all, the more chains we break, the faster we can get cases down to zero and keep it that way. And I love this quote from two of the psychology professors who are involved with Independent SAGE. If anything, the headline story should not be of fatigue and COVIDiots and house parties. They should highlight the remarkable and enduring resilience of the great majority of the population. Everybody is doing their bit to do it, but for some people, it's a lot harder than others. So thank you very much.
Thanks very much, Andrew. That's a lovely quote there at the end. And I think you've really highlighted very important issues that we can take policy actions on. The socio-economic aspects as well. Some people can't afford not to work as they see it. And so going from, find, test, trace to isolate and support. And I think it also points to maybe more public information and support targeted at key workers and identifying these issues that you've highlighted. But I'm sure that'll come up in the questions. So thanks very much, Andrew. Our next speaker is Professor Sam McConkey, Associate Professor and Head of the Department of International Health and Tropical Medicine at the Royal College of Surgeons and a member of ISAG. And Sam is going to talk to us about practical proposals for suppressing COVID-19 in Ireland. Sam, over to you.
Thank you, Frances. Just getting my screens sorted. Hopefully, is that better?
Yeah.
Are you seeing the right screen?
Yes, we are. It's a bit small there, but yes, I can go into it. Yes.
Thank you.
See presenter view, Sam.
Okay. I'm sorry, I'm not quite sure how to do that.
Can you unplug the other screen that you got attached?
Okay. I'm just on one. Apologies. I'm going to go back out and try and do it again. There we go. Thank you all. What I would like to talk about the next 5 or 6 minutes is around a document that many of us in ISAG have been working on, which is really to highlight how do we keep COVID-19 rates low in Ireland once we get there. This is the critical element, of course, in avoiding a fourth lockdown, if we like to put it that way. And I would like to say that, in summary, there's very, very many things that we could do better and differently that would achieve, I hope, keeping the levels very low. So it's not just a case of getting them low. We really have to keep them low if we're going to be successful. And inevitably, for several reasons, it will be reintroduced in one way or another. So being able to deal with those outbreaks robustly is a key public health or population health capacity that we need. The words are fraught with difficulty. When we say public health, some people think of just taxpayers funded curative healthcare. What I'm talking about is different. It's about how the whole population, now it could be the population of Clones or Monaghan or the whole of this country, but how we look at the population health rather than the population of Sam or somebody else, my mother. So it's groups of people, and there is a specialist area of healthcare of looking at the health of groups of people, particularly useful in pandemics, and it's called public health specialists, and that's what we really need. So a bit of overlap with the last talk because I'm talking some similar themes. So essentially 8 things. We need to measure the health and disease, and I'll look at how we could do that better. Detecting outbreaks, there are ways of using error codes and matching them in real time with computer geocoding to do that. Then communicating, develop partnerships, and that includes, as we just heard from Andrew, partnerships with businesses where there are more risk of transmission if they're essential businesses and still going. Create and implement solutions and legal structure. Then the skilled workforce is essential. I have said on primetime probably last March with Simon Coveney that we needed, in Wuhan, they had 5,000 contact tracers for a population of 11 million. So I put out that we needed 2,500 for our population that's half that size. Unfortunately, we've never got near that number. They've never really approached anything like 2,500 staff, either at central or local level, to deal with this. So we really need more people who are trained. Research, because this thing's changing, we can learn from others, and then organizational structure, particularly around executive. By executive, I mean getting things done, the power to implement, to do stuff with maybe not 100% effectiveness, but at least 90 or 95% effectiveness. We've often very good policies, but they're not implemented. So the testing and tracing has these multiple 8 different steps, and we're already doing those. The issue is that we're doing many of them much too slowly. They really all need to be completed on the same day. So if I have a test, if I get symptoms today, I have a test the same day, and then the people I live with know by this evening that they should not go out or go to work tomorrow if they're essential workers. We should have something like a performance management of 1 hour time from the test being available to people being informed and giving their contacts, and then 1 hour time to call the close contacts and maybe even the casual contacts, and increasing circles of contacts to let them know that they're in that situation. At present, we're told that the time delay is 1.5 to 2 days. So we're not approaching anything like the speed that has been successful in Asian countries to deal with this. The reason why that's important is that the virus is very infectious in the early period of its infection and even before symptoms occur. And if you want to protect the next generation of people from getting it, then you have to tell the people who have it quite quickly. As Andrew mentioned, getting pop-up testing, getting walk-in testing, bringing testing to the places where it's needed will make it much easier, rather than having to drive to Clontibret or Cavan or Croke Park. That we actually, if there are little outbreaks, we can have a pop-up test with 3 or 4 people who can do the test there and then in the areas where there's no one to be a little outbreak or even just 1 or 2 cases. Rather than just testing close contacts, what we've done in hospitals to control outbreak is testing casual contacts and essentially everyone who's ever been on those wards where there's an outbreak. And we're finding smaller numbers of cases, but some new cases as we expand the circles of testing. So if we really want robust control, we have to keep expanding our circles of testing until we find none in that next circle. And only then do you know that you've tested the people you need to test. There is this issue of support, as again Andrew's mentioned, that it is hard to self-isolate. It's hard to restrict movements. People have caring responsibilities for elderly, for vulnerable. They need shopping. They've caring for children. So people need help. And I think there's a role for voluntary groups, which have been outstanding in Ireland, to actually be mobilized to help people who need help. The detecting outbreaks, my view is we need backwards tracing to ask, where did I get my COVID from, rather than just who did I give it to? We have not been really systematically doing that in Ireland up to date. We're only going back 48 hours with the idea of who did that index case give it to. But if we're going to control an outbreak and prevent it spreading, we need to know who they got it from, and then who are all the contacts of that person they got it from, so that you can find other chains of transmission linked to the index case. That involves recording all error codes for 14 days and then a computer system that geocodes them and matches them. And then people on the ground locally, local contact tracing teams, to go to those businesses or private residences, set up pop-up testing and organize deep cleaning and the appropriate responses in those businesses that are needed after a possible outbreak there. We need that really to happen rapidly. There's no point in doing it 3 or 5 days later. It's the same day. Thankfully, our public health teams have been doing that for nursing homes, but not for many, excuse me, not for many other outbreaks, because they don't have the resources. So we really need that every suspected outbreak can have this rapid intervention to stop it spreading further. Our helplines, if you call a helpline, how long does it take to get a reply? We need accessible helpline, and then practical support. Communications. Obviously, Tony Houlihan has been doing a lot of this, I would suggest, very well, and many others. As Andrew mentioned, the businesses have not completely bought into this, in that many businesses recruit essential workers from abroad, but yet have them staying in squashed accommodation with, you know, people 5 or 6 to a room and so on. And unfortunately, not always with accessible GP care. Similarly, sectoral groups, whether it's truck drivers or the educational sector, need sectoral specific responses. So each sector, whether it's the the golf clubs of Ireland, the horse racing Ireland, we really need working groups with government stakeholders, public health specialists, and different industry representatives to help us solve how we can address COVID transmission as much as possible in all of those areas. Again, international and communication with those with COVID. The partnerships, managing contracts, I think, as Ursula von der Leyen has found out, can be really, really challenging. So our public health executive team need the ability to manage and reinforce and negotiate implementable contracts. This, I think, was the basic attribute in Netherlands and then later in Britain that led to the Industrial Revolution, when you had legally enforceable contracts that allowed us to be predictable in our relationships one with another. So managing those requires a lot of change, because the supply chain is challenging. So businesses, it's looking at things like cafeteria and toilets and where people are taking their breaks, looking at ventilation. So there's a lot that can be done there. The landlords, again, are, I feel, business owners. Landlords are business owners, and they have not really taken on board their responsibility for making safe the offering of housing that they are providing to the people who are paying them for it. And I can't quite understand that. There are some rules in Ireland about the size of a room that should be rented out to 1 or 2 or 3 people, but those don't seem to be enforced. There was a primetime thing on it that I was involved with in December, and it was absolutely shocking, and it doesn't appear to have been addressed. So we're 1 year into this, but this basic issue of human crowding and almost inhumane conditions of tenancy have not yet been solved and addressed. So there are legal changes. The HPSC has done a great job on regulation, but what's not so strong is on their implementation, which means we need staff, we need recruit, train, support, public health specialists, doctors, nurses, IT people, lab staff, contract management staff, and then teams in each town, village and suburb to do the deep cleans, to go to the places where there's been outbreaks, help them with advice, and do the pop-up testing. Research, this is the research team that have done vaccine work with a vector actually very similar to the Oxford virus, except ours was against malaria, because that's what I'm interested in rather than against adenovirus. But so we've done first in human studies in Ireland with the same vector as has been used in the Oxford vaccine. It involves creating new knowledge, and that's a fairly audacious challenge, but that's what many of us are trying to do and have to do at this time. It's also important to look at the knowledge from other places, critique it, and see how it can be applied here. You don't need to reinvent the wheel. Then the organizational structure, especially around execution, around implementation, it's about quality management. It's about making sure that our policies on outbreak control are being followed, and if there are resource problems, that those are being addressed and fixed. If there are lack of knowledge problems, that those are being addressed and fixed. Because I would put to you that the HPSC and the European Centre for Disease Control have very good policies, but just we're not implementing them in outbreaks or in case control with anything like the rigor that's necessary to keep it on. But we could do that. So thank you. I'm happy to take questions.
Thanks very much, Sam. Look, it seems to me you have a really good implementation plan there. It's a question of, how do you build up the resources around each of those issues that you've addressed, and that you have really clear implementation plans around each of them. I mean, if you just take the testing and tracing alone, what you're suggesting really does need a very big extra input to get to the point that you're speaking about, and each of the other areas as well. Conscious of time, because we do want to have 15 or 20 minutes for questions, and we have some questions coming in. But before that, we're going to hear from Professor Matthias Schneider. Matthias is the Professor of Physics, Medical and Biological Physics in the Technical University of Dortmund in Germany. And he's going to speak about the no COVID movement in Germany. Matthias, I know you're there. You're very welcome. Thank you.
Can you hear me now?
Yes, absolutely.
Excellent.
Go ahead.
You can see the screen as well.
Yes, it's all fine.
Or started well. Well, thank you very much. I'm here to tell you a story of what happened in the past couple of weeks here in Germany. I'm not going to give you technical details because you have wonderful experts there that don't need my advice. I just rather want to tell you how we changed the narrative in Germany in just 7 days. Kind of a crazy story, and we still are all on a trip, I want to say. I think it started about like 2 or 3 months ago, really. And we all were frustrated, as you can imagine, about the way things goes, or still go, or were going. And we see this, all these scientists are here, they all have the same kind of story to tell. Everything seems convincing, but nothing moves into the right direction. So I think the story of success, at least the way it worked here, has 3 major ingredients, the way we could change flip the narrative here over here. And the first one is get the right people together. The reason behind this is to understand this is not a science and health problem only. You need a much larger variety of people. And it's good to have independent people. I think that was just made us very flexible. So we put, or I started to put people together, not just from biology and medicine, but also from social science, law professors, economy, from public and global health, as well as, and very important, very, very important, what I had to learn, communication. Because the public does not really understand what's going on. For whatever reason, what I don't want to identify whose fault it is, but it's very clear that the public does not know what to expect. They are in a state of uncertainty, they are confused, and it's getting harder and harder to communicate with them. So you need also to have people on board that can communicate the story, because the story is not difficult. So we are a whole bunch of people. We are 13 as the core of this proposal that we put out, that we wrote up in like 7 days and published it in Die Zeit, one of the major newspapers here. And it went through the news like a virus, so to say. So we are all over the news. We are invited by politicians basically every single day. I actually have another appointment later this afternoon, where we talked about a couple of major mayors. Yesterday, we talked about, policymakers in some of the states. So we have really got something going. I cannot tell you whether it's going to work or not, but we are trying. The second important point of the strategy was that you learn, that you bring in people that have done it successfully. This was actually when I was talking with Janir about this, that it became more and more clear to me. Because it seems so obvious that we have to learn from them, but it's a hard topic to deliver. Because as soon as you talk about New Zealand, everybody tells you that we are not an isle in Europe. And as soon as you talk about mainland China or other Asian countries, people tell you, well, we are not in a dictatorship. But the point is, and that's what we're trying to flip, and I think we managed, is that we have to learn from them as much as possible. And the things we can't transfer from New Zealand, from Australia, or from Taiwan or Thailand or whatnot to Europe, we have to invent ourselves. But we have tools for this, and just heard from Andrew, I couldn't agree more how important testing is. And New Zealand was not nearly there with their testing strategy when they started to go on a no COVID strategy. No, they were nearly there in terms of testing technologies that we have today. And when Australia started to go bring Melbourne to zero, a 4 million people city, talking about an isle, who cares? It's a 4 million people city. They brought it down in, I think, something from low numbers to zero in less than a month. And this was before FFP2 or N95 masks were mandated. So this was still like just a scarf that people had to wear at that time. So we have new tools, and what I'm trying to say, I guess, is that we have to realize that we have to transport that as scientists here to the population. That yes, of course there are differences. There are also differences between East and West Berlin, but we have to learn as much as possible and have to transfer it and apply it in Germany as good as possible. And what's left the question that remains open. We have to find different solutions in a multidisciplinary way. And I want to point out especially how I learned from Michael, because they are part of our team. So we have this core 13 scientists, and then we have our external advisory team, which is Stephen and Michael and Aistis and Janir from the pioneer of the green zone model that we want to push through here. The way Michael pointed it out, the way New Zealand went was they understood that we have to respond decisively. You can't be reactive, because the virus will always surprise you. You have to be a step ahead. There's just no other way. And this is actually a physical principle of such nonlinear systems. And so you have to do this with good science, and you need good leadership. This is what I also mean by communication. You can't leave the public alone. It's like, I don't know if you're going to open, we will see. And you have to be aware of complacent exceptionalism over here in Europe. At least in Germany, I really felt this a lot. It felt like almost like people, this is a problem that only China will have. And as soon as it hits Europe, it's just going to disappear. And Europeans are going to, we are already immune against this China's virus. You know the words of the former president of the United States. And so the way Michael pitching the story is, he says that, so they had to they looked at the Western world, like Europe, USA, and they looked at Asia, and they clearly came to the conclusion, Asia does a better job. So let's try to learn from Asia. I think it's so crystal clear. And I'm very happy that we're now at the point where people here in Germany in TV and politicians in interviews, they have to argue now why they are not going the way from Australia, as opposed to 4 weeks ago when it was, why would you go the Australian way? You're not an isle. So this really changed. So we are trying to change the narrative, and we are trying to make this something positive. A third ingredient that was important, at least to us, that we had a clear focus to solve issues. So we are always trying to get connected to the politicians and ask them, what are your worries? Where are your headaches? Is it like border control? Is it like commuters that, like, we are applying the green zone model? Do you have somebody sitting or living in the red zone, has to work in the green zone? How do you solve that? Because everybody at the beginning, we had to learn that everybody believed we want to just shut down every single border in Europe. It's just not at all the case. And Janir is my honor to be here. Can explain you much more on the details, but I think you probably already know that this is not necessary. The idea of the green zone model is, and this is also part of the narrative that you have to explain to people, the idea is not to shut things down, but to open quickly. You don't want to have a nice county or Landkreis, as we call it here, on lockdown with the whole country if this county or Landkreis is already at zero virus. Why would you? No, you have to make sure that no new virus is coming back into this district or into this green zone. So you have to see the green zone as an achievement of the population. You have to be proud of. You have to see how the numbers go down, and people need to celebrate once they're down at zero. And then the best way to protect the green zone, make sure that no new virus comes in once you're down at zero, is to tell your neighbors, please get green as well. Because that's the easiest way. If you think about a little county here, this is somewhere in the northeast of Germany, is turning green. The best way to protect this county is that everything around it is green as well. It will make things a lot easier. So we would hope that somebody starts flipping, some governor or some politicians, maybe even a mayor of a major city. We are talking to them. Some of them actually are leaning definitely towards us. And we hope that one of them starts, and this is actually really kicking off a real wave. I don't want to get into details how you do that. I think I think the technical details you have down completely. Important is always, we found, communicate the facts. We're getting tons and tons of emails of people that told us, thank you so much that we included this list of myths, debunking myths about what's wrong, what's out there since months and months, and blocks people's mind. One thing is that we always hear Europe is an isle, so we can't learn from New Zealand. So I mean, I think I already debunked that one. The second is the trade-off between science and economy. So excuse me, that should be medicine or health, not science, and economy. That should be health here, which is nonsense. Health, people in hospitals don't buy. People who are in a state of uncertainty don't go shopping. That's not the problem at all. That's actually the other way around. So the state of uncertainty is what drives people nuts, what makes them not invest. So that's why we put one of the most famous economists into the group, those two from the IFO Institute in Munich, which are not very exactly known for being left-wing. So they're quite conservative. And of course, we also have our people from the external world in there, like Stephen Duckett from Australia, who tells the same narrative. So right now, this narrative, I can say, I think I'm safe to say this narrative that health and economy are somewhere contradictory is off, or is out of the German news. 3, the other myth, kids suffer during lockdown, so we need to open schools. At least in Germany, this was a big debate. It's not true. It's not at all like that. It's not that simple. Don't get me wrong. Kids should be in school, of course, but the unpredictability is much worse. So we have Mino Baumann, who is a family and a teaching expert, who did studies which showed that violence at home with children did not increase during lockdown, but during the open and close phase, when the state was not able to navigate anymore, when you had no predictability, do you have to close schools or not? And we all know with the new variants, we heard it early on, this is not going to get better. At least I don't see why it should. So to have a clear goal to say we shut down now for a certain amount of time, and then we look how the numbers go down, and then we open together and protect the open state, is something that brings people into this driving seat again. And that, I think this could inspire something positive and collective in the population. At least this seems to be our first feedback. And in Germany, the whole thing, we can do it. It's nonsense as well. It's very easy to debunk this one. It's impossible now to come to zero. It's very easy to debunk because we already did it. These are the data from the first wave on the left. You see the February, March. On the y-axis, you have the number of counties or Landkreise in Germany that's been at a certain number of incidents. White means it was 0. So you see in the entire time, the entire summer, 100 to 150 out of 400 counties in Germany already were at 0 for more than a month. So if we were done, we were more than halfway there. We just didn't protect it. We just didn't keep it down because we opened up. We didn't talk about anything else, but open up again. And here we go, the second wave. And if you don't watch it, we will get the third one. You all know that. So we try to debunk all those very stubborn myths out there in the news. And I think it begins to work. And we get into the offices, we get into the ministries, we get into the department, all the sides of. We are actually trying to pull back from the news now a little bit. We get way too many invitations and trying to focus more on strategies, understand the problems that cities have, that more like rural areas have, and trying to offer solutions for them, working with them, trying to get into the dialogue with the politicians. And I want to summarize to point out this thing again, what was important for us in this group of 13 people, that our narrative is not just we want to save the hospitals from going under, but we want a healthy society back. We want a healthy school system. We want healthy families. We want a healthy economy, and we want, of course, also a good healthcare system. And it sounds like, well, of course we all want this, but the point is, it's really all the same. It's really all the same. You just need low numbers, and you get all of it. And you can get it, and you can protect your screen zones. Others have managed, and we will hopefully manage as well. But we have to get into the driving seat. We have to get proactive and not reactive. Reactive will never work. We will keep getting surprises. It will not work. So we have to change the narrative. We have to continue to focus on real life solutions. So we go to the mayors and we tell them how to solve their public transportation issues, and we go to the Gesundheitsamt, so the health institutions, and talk with them about testing systems. We bring in experts in testing systems. So our group is growing, but we maintain the core because we want to maintain our drive, and this is very important to us. And make sure the medias don't distract you too much. So I'm trying to stay out of them. So it's been a great pleasure for mine. Please stay in touch.
Thank you very much, Matthias, for that, I think, quite optimistic presentation. And I'd be very interested in the views of our panel to what you've had to say. I'm still trying to work out what the last quotation means. When you mix science and politics, too bad, because I think what we need is bridge building between everyone, actually. And you very much focus on the proactive approach. You're really talking about engaging with politics quite a lot, I think, in your presentation at local level as well as, you know, national level. So look, most of the questions that have been put in have actually been answered on screen, but I will go back to one in particular about schools. But before I do this, could I ask the panelists who are with us to react to Matthias and bring it over to the Irish context as to where you see us in terms of what Matthias is saying, and what are the challenges, and how do we need to move forward proactively along the lines that Matthias has been speaking of. We've obviously done certain things. It's not that we haven't been doing this, but I'm just interested in your response. Who amongst the panelists would like to come in? Anyone in particular like to come in there?
I'll come in for a moment. I think that
yes.
The fact that there's a no COVID movement in Germany that is getting such serious engagement and traction from German legislators, I really think serves to show the legitimacy of zero COVID style approaches in Europe. And obviously it's a huge advantage to be in Ireland, but it's not necessary. If Australia and New Zealand had made the same decisions that Ireland had made and other European countries had made, they would be in exactly the same position as us. So this is mainly about political choices that uses science in order to find a solution that works for everyone. And of course, it needs to be tailored for your own country, your own culture, and so on. But I think that Germany is really leading the way, I think, conceptually in considering zero COVID type approaches in a serious way. But I think that we in Ireland have the opportunity to be the early adopters of this in Europe, because it should be more straightforward for us to do this being in Ireland. And we also have had, I think it's worth pointing out, there are many things to be critical of the current government approach to COVID-19 in Ireland, but there's also many things that have been done correctly. And one thing that I think was a success here last summer was that we almost had a green zone approach, because the government framework, which we think at ISAG, we think it's a good framework. It's not a strategy. Strategy would be how do you use the framework to get to level 1, but the framework itself is good. The framework of having 5 different levels that can be enacted on a county basis provides for a green zone model in Ireland. And despite significant opposition to it and a lot of naysayers in the media last summer, putting Kildare, Laois and Offaly under local restrictions worked quite effectively and worked quite quickly. Unfortunately, we didn't get to the point of allowing other counties like Kerry or Waterford to get down to level 1 or level 2 when they had effectively very low transmission. But we showed that it could be done here, and it probably can be done based on commuter zones rather than on actual counties, because county boundaries do become quite arbitrary. But the point is that we know that green zones work here, or can work here. We know that travel quarantine can work here because we're an island if we choose to implement it. And that's partly why we had such low cases relative to other European neighbors in the early and middle of last summer. And so I think we're well positioned to take lessons from the no COVID movement, in a sense, in terms of engaging on this topic in a serious way.
Thanks, Thomas. Dr. Gabriel Scally, can I ask you, you wanted to come in, could I ask you maybe as well to address that issue of the next steps in building up the alliance between the scientific community, all of the scientific community, and politicians and governments? Just, responding to what Matthias had to say about that, what do you see as the next steps on that? But you wanted to come in and make your own point as well. Gabriel.
Well, Francis, thank you for that. My point was going to be along that line anyway, because I was terribly impressed by the German report. I thought it was absolutely excellent, and the traction they've achieved is remarkable and a great credit to them. I think they've done fantastically well. I was also very impressed to see the editorial piece from the editor, actually, of The Lancet, one of the world's leading medical journals, where he said perhaps there is an emerging agreement that the elimination of this coronavirus is not only necessary but also achievable. And I think that consensus has grown, and it has grown substantially amongst the population. I think people are fed up with having to live with this virus, as we were told we had to do, and mutual coexistence is not possible. It is absolutely not possible. And we know that, and things are very dangerous with the variants coming. So it's an issue for us translating that clear popular sentiment into political action and giving politicians the confidence that it can happen. Now, one of the things that has bedeviled the response, both in the UK and in Ireland, across the whole of Ireland, has been the poor state of the public health systems that we have. Northern Ireland, for example, is the only part of these islands that doesn't have local public health teams. It doesn't have local directors of public health. Those were abolished some years ago. We know, and my first engagement in reporting on this to the government was in 2001 about the impoverished state of the public health system in the state, in the Republic of Ireland, and I reported again, or at least the report was published in 2018 on that, and we still haven't seen any significant change. Now, that poverty of public health system has to change, and we need to convince the politicians that we can very rapidly mobilize the people we need to not just to do the things like the managed isolation at borders, which is extraordinarily important, but we need to have local teams right across the country that are well staffed, resilient, under good public health control, with the support they need and good management support as well, and the resources they need to really suppress the virus when it appears across the country. But I think the difficult challenge, could you just say I'm a great fan of the green zones, and having worked on the border in South Armagh, I worked in Forkhill and Crossmaglen, and having worked there as a general practitioner, I know how difficult that area is. Even in these times of peace on it, it's still difficult, and we need to be able to do that. But we need to have confidence in our border communities. Our border communities have been through so much. They are so resilient and so strong. And much of the anger that has happened about the border issue has been people in border communities who are fed up with others driving across their communities and coming in and out. The border communities, I think we should have more respect for, and the politicians, I think, who are making these decisions need to understand the border communities if they are empowered as part of a green zones area, they will monitor the border. They know who goes back and forward and where they're doing it, absolutely. And winning them over and engaging them and mobilizing them is extraordinarily important. So I think there's a mobilization system that is needed to produce that public health response, show people that it can be recruited, put in place, and also to mobilize border communities would be my two suggestions for a way forward.
Thanks, Gabriel. I mean, I think that's a really important point about tapping into the resilience of the public. I think that's come up again and again. How do we do that? Who needs to do it? Just on building up the public health resources, is that a question of recruitment of teams? Or, I'm putting it simply, but is that the primary issue you would be saying to government? Recruit more?
Well, firstly, I feel very strongly we've got these great directors of public health in the Republic of Ireland. I was on the appointments panels of some of them, and I know how good they are, but they're practically invisible in the system. And I would put them to the fore so that they are well known in their communities and to the local politicians and to the TDs in their area, and that they are given the resources and the management support to do an outstanding job and give that leadership. it's all very well people sitting all around the place looking at a chief medical officer, even one as brilliant as Tony Holohan, talking from the centre. But having someone who knows your town and your village and your county situation is so important. So I would prioritise the local directors of public health, and I would give them all the resources they need. It is buttons compared to what's being driven out of our country by this awful pandemic, by the economic and social devastation.
We can't have an economy if we don't control COVID. That's obvious. I think that debate is
I mean, one thing, sorry, Francis. One thing that we do, just to kind of just very quickly respond to,
yes.
We are still trying to, the same approach that we started, like going and talk to the people in Australia, New Zealand, and so on, and their experiences. We are right now basically trying to find who are the best, who are the best or the leading public health institutions in Germany, which cities have it best under control. So we are trying to put together kind of a toolbox, a catalog of best practice institutions, so that we can go to those who have issues and say, so here, this is the way they do it. And so it's to answer the question of Francis, at least the way we are approaching it, it's not just recruit more, but it's also trying to learn more from those who already have solved many issues, including companies, by the way. We have companies that have an extremely good testing system already running. They are rather going to be upset about a lockdown because they can live safely without it.
Thanks, Matthias. It's kind of, as you're saying, mapping. I think maybe take up Gabriel's point as well. There's a bit more mapping needed and public awareness of the resources that are actually there. I think the other point that's come up a lot this morning is employers and working with business and needing to move more in that direction. I think everyone has been saying that. Now, Julian would like to come in, and then Anthony. And then I'll put the two questions I want to before we finish up that have come in through the public. So Julian.
Thanks, Francis. I'll be very brief. I just wanted to really welcome this kind of European movement. It's very, very important to have a European action because the power of an example is so powerful in solving this. If you have any city in Germany, France, anywhere, it would be so powerful. People will see it's possible. That's why we need good contact. And by the way, that's precisely why the Irish media and Irish government never talked about New Zealand and Australia until about 3 weeks ago when Novak Djokovic got caught in that quarantine story. Because if people had seen those successful examples, there would have been a lot of pressure on the government to say, hey, they're doing it there. It's kind of similar to us. Why don't we do it? So I hope really the European networking will really go further because, like you said, Matthias, if even a mayor of a big city gets a good situation, you can't ignore it anymore. And it will go very, very fast. What struck me in your presentation is how similar to what we are doing. The general principles are not very difficult to understand. It's about implementation. So it's really nice that we have this kind of synergy going on between Germany and other countries, hopefully.
Yeah, we're actually right now talking a lot with with people in France as well. So yeah.
And thank you, Matthias, for joining us today. I quite agree. It's very good to get the European perspective. And if we can see models of success, that's always a great help. Anthony.
Two things. There's some use of language which is intended to shut down discussion. So a lot of people are talking about sealing the border, which is manifestly impossible, as if that completely undermines the whole exercise. So just to be clear, zero COVID, no COVID does not require, expect, or plan for sealing borders.
Correct.
There's a very specific Irish challenge. I'm very familiar with the information systems across Europe. It's kind of my job, which is our data systems are unbelievably awful. New Zealand and ourselves started in the same place with contact tracing in March of last year, doing it with paper and pen. New Zealand brought in an IT system, a very crude IT system, in about 10 days. We brought in a similar system in about 4 weeks. We still have the same system. In fact, we now have 3 systems which don't talk to each other. New Zealand has a system which is integrated with phone apps, which allows detailed tracking. So when you're released from quarantine in New Zealand, you have an app on your phone and you must keep it on your phone for a period of time. So they know where you've been, who you've been in contact with. So there is a data issue as well as an issue about public health. And my final point is, it's often said it takes 5 to 7 years to train new public health staff. And that's true. But to train contact tracers is a day's work. If you start with the right sort of person, for example, a barman makes a phenomenally good contact tracer. A waiter, a good sociable waiter, is phenomenally good contact tracer. Sociable people are great contact tracers, and I can train them in a day.
Thanks, Anthony. Two of the questions that have come in on the chat here is, one is about if we open schools. I think it's a very interesting one. If we open schools, given the new variants, are we going to have to take further mitigation measures? So that's a question that's come in. Who'd like to respond to that? Complex enough question. Yanir there, yes.
Yeah, so unfortunately, opening schools would really undermine the ability to control the disease. The actions necessary to protect schools from dramatic transmission are beyond applicable, beyond the ability to implement them at this time. But also, we've just learned about, there's a new study on long COVID in children. It's the first actual study. And it's still a small sample, but 129 children, and about 50% of them had significant symptoms for 12 weeks. And it's a very significant difficulty for children who get even milder asymptomatic cases. And I think our understanding of what we're doing by exposing children should change.
Mm-hmm.
Anybody else like to come in on that particular one? Because I think that's clearly a big public policy issue in terms of what the science is telling us and where we're going. Let me see who's coming in. I think Anthony and Gabriel. So Anthony?
Very quickly, we've had a narrative in Ireland that schools are safe. They're as safe as the community around them, and no safer. So as cases rise in the community, the risks of opening schools become higher and higher. So that the secret to opening schools safely is to drive cases down as low as possible, and preferably to zero in the communities. And then we can open schools to our heart's content.
Utterly connected. Okay, Gabriel?
Just one point, and I don't, I make this point often, but it is worth making, that I am very, very unhappy with the idea, and it may become a more prevalent idea as vaccination takes hold, that it's all right for children to get COVID-19 because they don't suffer. There is long COVID, absolutely important. Yanir mentioned the study, and it really is an issue. But I remember from my public health training about the connection between Spanish flu and in subsequent decades, Parkinson's disease, and a huge incidence of Parkinson's disease amongst people who had been through Spanish flu, survived Spanish flu, were little affected by it. But it had in some way, it was postulated, changed their brains and made them perhaps more susceptible to further infection, which gave them Parkinson's. And we know that this virus affects the brain. Long COVID symptoms tell us that. The brain fog, the peripheral neurological symptoms that people are having, the fatigue, all of that points straight to this virus having an effect on the brain. And we really don't know what else this virus has in store for us. And I take the precautionary approach. Of course, I'm a public health doctor, and I don't want kids under any circumstance to get this virus. So I think we have to be very careful about schools opening. And I absolutely agree with the point about the necessity of suppressing the virus in local communities, and that being one of the key points. Thank you.
Thanks very much, Gabriel. I mean, I think that's a very key point. In terms of another question that's come up, it was about long COVID. It's kind of linked to this discussion about children's vulnerability and so on, and the long-term impact. One of the participants said, why is there so little discussion about long COVID? And I think that raises an interesting point linked to what you were saying about, breaking the myths that are out there. Matthias talked about that a lot. And you talked about this idea of that's in the public arena of sealing the border, which, as you say, kind of makes people dismiss the whole idea because we know that it's not realistic to seal it completely, even if we wanted to. So this idea of why long COVID or the long-term effects isn't being discussed more. I guess we're in a crisis, so we're looking at it right now. But would anybody like to just address that issue and how we bring the public along to understand the kind of the bigger issues around this in the so that our time frame isn't just right now, it's also, you know, medium and longer term. Any particular point on that anybody would like to make? Matthias.
I can say one thing that we are trying to bring across to the policymakers right now, that if you break harder, you don't have to break as long. Which means if you keep the schools closed for a little longer, then you, let's say, a simple calculation that has been published recently or has been shown, you break twice as hard, meaning like you bring the numbers down per week twice as much, will shorten the time by a factor of one third. So instead of needing 3 months, you break twice as hard. You need only 1 month. It's a very nonlinear effect. So you keep the schools closed for a little longer, but then you can open safely much earlier. So this needs to enter people's head. It's like that the long-term perspective needs to come into play. And also the fact that this is something that a family can plan. So we don't have to just talk about children. It's the family that really matters. The whole family matters. Because if the dad doesn't know on Friday afternoon whether he can go to work on Monday because he or she doesn't know whether the kids can go to school, this is where, at least according to the studies in Germany from Menno Baumann, this is where the punches fly at home. This is where the kids get punished and get all kinds of disastrous consequences. I think this needs to end at the head of the policymakers, that it's not a question, are we going to close schools now or we're going to keep them open? So it's a matter from how long we're going to close them and how quickly we're going to open them.
Matthias, a quick question. As a politician, I'm asking you this. How have you built the engagement between scientists and politicians in Germany? Any particular points you'd like to make on that? We're going to have to finish up now, but I'd just be interested in that because I think there's a very important bridge building that we need to do between the scientific community and politicians right across the country.
Basically, I connected to as much people as possible that I've found are on the same page as me, and some of them had connections to politicians, and then the network exploded. This was very simple. I had no particular target. I'm a pure scientist, and then some of them came in. Some of the physicists came in that are advisors from Merkel. The two advisors, Melanie Brinkmann and Michael Meyer-Hermann, in the group, and they both have been advisors from Merkel already. It was just so I had no particular plan.
Building the network.
Building a network, yes, and that was actually a near suggestion a while back.
Thanks very much, Matthias. And I think we're going to have to finish up. I want to thank all our participants. I think we've covered many of the areas, both by way of thank you for your written replies to the questions that came in and for the discussion. I want to thank all of today's speakers for their contributions, for sharing your expertise, for doing all of this work. It's clearly informing the public debate in a very important way. And we've got some really insightful questions that came in as well. So thanks very much. Thank you for inviting me to chair this session. Delighted to, and really appreciate each and every person's contribution today. And I hope we can continue to be proactive about sharing all of this information. It's life-saving, obviously, and incredibly important in terms of how our country manages COVID. So thanks, everybody, until we meet again. Thanks very much indeed.
Thank you very much.